All right, welcome back. So we talked about kind of some things to pay attention to do your scene size up for safety and your initial impression. So let's look at this picture here. Now, I'm going to pull this a little bit closer to me. So in this picture, a few things that are really kind of concerning. First of all, we have two patients, okay? And I have smoke coming out here. I have some sort of chemical spill here. This is knocked over here, and it looks like I have a forklift here, which is like a motorized dolly that's able to lift really heavy things up and down. So I have both of these here, and I don't see a pool of blood, which means that they probably don't have any huge form of trauma. At least, that would make them bleed. So I'm almost thinking, since there's two of them and none of them have anything fallen on top of them to incapacitate them at the same time, I'm thinking maybe there's some sort of inhalation or poisonous gas coming off of this. So this is something that I wouldn't even approach if you paid me. So you need to back off, call 911. You need to let them know why you can't enter the scene. Because they need to send a hazmat unit as well as EMS. And also, after you've called 911, if it's safe to, find a supervisor elsewhere in that facility. It looks like this is in some sort of warehouse, and maybe they know how to handle some sort of chemical spill that they have in their building. But definitely keep yourself safe, call 911 immediately, and get out of there, out of immediate danger. All right, this next one. I don't know about you, but I don't just fall asleep on random benches with my face down. Okay, first of all, I don't really like strange things touching my face because you get sick really easy that way. So either A, he is stone cold drunk, or B, something's seriously wrong. So if we look around, we don't really see any other dangers. I don't see any weapons on the ground. There's no other people in the picture. I'm thinking maybe it's just him. So I would be okay with approaching this guy and checking for responsiveness. So to me right now, this doesn't look like an injury. This looks more like an illness medical problem. Either that or he's just sleeping. Maybe, maybe not. Okay, but it could potentially be something really wrong. Okay, so now in all the videos that you've seen so far, this is kind of like medicine in a perfect world, right? There's helpful bystanders that have the equipment you ask for. You may be in a situation where there's nobody around to help you. You may have to decide whether you're going to call 911 first or you're going to render care first. Okay. What if you're in an area of a building that you don't have signal and you have to run down the hallway to get to a phone? What if you're on vacation out in the wilderness hiking and there's no cell towers around, so you don't have signal, right? And it's potentially miles until there's another soul, So you need to be able to take your situation and see, is it going to be more beneficial for this person for me to call, run and get help and call first? Or should I provide care first? Okay, and there's even some times where you have a phone right next to you. Do you call somebody first or do you render care first? Now, two very common situations could be cardiac arrest. In general, cardiac arrest is default to you need to call 911 first because ultimately they need advanced life support. The second, where you would care first, you would provide the care, these would be for like breathing emergencies or anaphylaxis where they have an EpiPen auto-injector. You would deliver the epinephrine before calling help because the threat to their airway and breathing would be greater. It would be more beneficial for them to have the medication first than delay a minute or two for you to call somebody and then give a medication. Life-threatening bleeding. If somebody is going to bleed out within a few minutes, why don't you make a tourniquet or grab a tourniquet if you have one with you. You're Johnny on the spot. I don't carry a tourniquet with me everywhere I go. But life-threatening bleeding, provide direct pressure. You can make a tourniquet out of, you can rip off some fabric from your pant leg. If you have a first aid kit around, you can use gauze. That gauze is a great tourniquet. Okay, so but with life-threatening bleeding, that's one of those instances where you will provide the care first. So you will call 911 first for any person above 12 years who is unresponsive. You will call first if you see a child or an infant suddenly collapse. If you witness them collapse, you will call first. If you have an unresponsive child or infant who's known to have heart problems, you're going to call first. Now, I used to get really confused with the whole child and infant thing because there's going to be some times where we're going to render care first. Okay, and I'll explain. So we'll just go through it and then I'll explain. So an unresponsive infant or child younger than 12 years who you did not see collapse. A person who is choking, right? I've worked in restaurants for years and I've done a Heimlich on many people. Not many, probably a handful. But still, none of them I ever had to call 911. I could fix the situation and they wound up living just fine. So you definitely render care first for choking. A person who's experiencing a severe allergic reaction and has an auto-injector, if they do not have their medication, then ultimately you really need to call 911. But if they have that EpiPen, that epinephrine auto-injector, you use it. All right, and a person who has life-threatening bleeding. So the reason why you would provide care first for a child or an infant younger than 12 years that you didn't see collapse is because the majority of full arrests where a child's heart is not beating or not beating properly to get enough blood to their organs, it's usually more often than not caused by some respiratory arrest where it's through a failure in their respiratory system, how they breathe. Okay, so if you can fix the cause, you can hopefully revive them, and hopefully this happens in a very fast amount of time. However, if you have a child like a child or infant that has heart problems, then it's more safe to assume that they've had some sort of cardiac cause to their full arrest where their heart isn't beating, and it would be more apt to need advanced life support in order to revive them. So the respiratory cause ones are a little quicker and easier to remedy, and hopefully you get them alive so that you can call 911 and it can work with a live patient. The faster that you can resuscitate them, the better it is for them, and the better chance they have of being resuscitated. Okay. Now, when you go to render care for anybody, you go to help them, right? You need to protect yourself. Okay, so there's what's called personal protective equipment. This is PPE, right? Remember how I said gloves? It could be goggles, it could be a mask, it could be a gown. It doesn't matter. So you want to create a barrier so that if you get any sort of bodily fluids on you from that patient, you don't get infected from them. Okay, people, especially if they're not breathing, can't tell you that they have something like HIV or hepatitis, something like that. So always, always, always look out for yourself and protect yourself with personal protective equipment. Whenever you have gloves, you should have the latex-free disposable gloves, right? So those are what you should be stocking in your first aid kits. I also keep a box of gloves in my car because they also work really well when I clean it or when I work on my car. So I automatically will have those around, but the latex-free, I prefer nitrile. if you ever go and buy your own. But you should always use disposable gloves and have some sort of CPR breathing barrier in your first aid kit. You can also purchase these little nifty all-in-one packs, and this is where they'll have gloves, breathing barriers, all contained into one little package. And some people have them on their key rings, some people have them in their cars. You never know. So always ask, always try to have these available to you just in case the worst happens. Hopefully you never have to use it, but you have it available to you. So thank you for paying attention. I'll let you get on with your week, and we'll pick up with this on Monday.